Health and well-being, a fundamental need for everyone, and something we often take for granted. But what would you do if there was an outbreak of disease at your school or work and people were getting seriously ill? What would you do if you went to the hospital with an emergency and got put in a queue? What would you do if you were in need of medical treatment and your community had no qualified professionals to provide it? What would you do if you had an infectious disease but didn't trust the treatment being pushed by the health authorities? What would you do if you became seriously depressed but the medication prescribed for you didn't work? Here at the London School of Economics and Political Science, we challenge the conventional approaches to modern healthcare, conducting research that helps to improve healthcare policy and practice around the world. How can we trust that the food we consume is safe to eat? How can the government ensure that farms and restaurants are not putting us at risk? How can sick or injured people be treated as quickly and efficiently as possible? What is the best way to cut hospital queues and ambulance response times? What strategies are best for recruiting talented people to work in healthcare in developing countries, and which are best for motivating and retaining them? What factors impede the success of programs to eradicate infectious diseases in developing countries? In particular, how can local suspicion and mistrust be overcome? How should we deal with increasing rates of anxiety and depression? How can we help people get happy and stay happy? These are the questions of our time. And here at the LSE, we have been able, by generating and sharing knowledge, to challenge conventional approaches in healthcare policy and practice. To find out more about our work in any of these areas, or about our research impact in general, click on a link.